Today's webinar will cover HealthCare.gov auto-renewal process for 2022 coverage, including the process for plan enrollment and redetermination of premium tax credit eligibility. Today's presenter here at the Center on Budget and Policy Priorities is Tara Straw, the Director of Health Insurance and Marketplace Policy. And I'll turn it over to Tara.
Great, thank you so much, Ina. And thanks everyone for joining us. We're going to talk today about renewals and redetermination, mostly in HealthCare.gov, but I'm sure that these lessons also apply to many state-based marketplaces. So as Ina said, we're going to talk about redetermination. So by that we mean the redetermination of APTC and CSR, so advanced premium tax credit and cost sharing reductions. We're going to use those acronyms throughout, and re-enrollment in the same or a different plan. And we're going to run down the bevy of notices sent by HealthCare.gov and insurers, which can be really confusing for enrollees. Next slide, please. Open enrollment. You guys already know this, but we put it here for completeness. HealthCare.gov's open enrollment period is November 1st through January 15th. And of course, this is a month extension from the previous several years. Auto enrollment will occur though December 16th for January 1st coverage. And that's a point that we're going to make several times throughout this, is that even though people can choose a plan until January 15th, auto re-enrollment still happens on December 16th. So people will find themselves in a different plan, in a plan, but they can still choose a different plan. And as I said, we're going to really hone in on that point because it's a complicated one and it's important to understand. If someone enrolls after December 15th, their coverage effective date won't be until February 1st. So you can't, if you enroll, say, January 4th, you can't get January coverage in the plan that you enroll in. You still have to wait until February 1st. Next slide, please. And here's a little rundown of where the state-based marketplaces are. You can see that some marketplaces extend their open enrollment the whole way into January 31st, but some are still at December 15th. And if you're in one of those states, I think most of those states, I would not be surprised if they also extend their open enrollment period to match the federal OE, but that remains to be seen. Next. So, and next slide. So we're going to talk about re-enrollment, and we've got a bigger population this year to re-enroll. The American Rescue Plan, or ARP, we'll use that acronym, created big opportunities for people to claim lower premiums and higher APTC. And nationwide, many people did this. 8 million existing enrollees claimed higher APTC or lower premiums, and that was done through a combination of people returning to their applications. 2.7 million HealthCare.gov enrollees returned to their applications. They responded to all the messages they got, telling them to come back and get more APTC, and others were automatically redetermined. So in HealthCare.gov, it was 2.6 million. It wasn't everyone. So not everyone saw their discounts, but in some state-based marketplaces, they took earlier action to automatically redetermine people. So that's one reason that we get such a big number of existing enrollees who see discounts. It's also worth noting that more than 200,000 people benefited from a provision in the ARP that allowed people who were determined eligible for or received unemployment compensation for any week in the year that made them eligible for enhanced APTC and CSRs as if they had income of 138% of FPL. So they got the most generous APTC, the most generous CSR, regardless of their actual income. So that's not a huge number of people, but as we'll see, it's a number of people who will be who could be really affected this year. So you're going to see that you'll probably see people who didn't claim their APTC, and so they might be surprised and maybe and hopefully happy when they come back to you and see the discounts they're eligible for. And of course, if people didn't come back in 2021 to get the additional APTC, they'll be able to get it on their tax return when they file for this year. Next slide. So we say this every year, and you know this, but to bring it home, the best advice is to return to the marketplace. That's always the case. We want people to update, and we want them to update, a lot of different elements of their application. So why do we want them to update? It's because we want them to get the most accurate eligibility determination for Medicaid, for APTC, and for cost sharing reductions. And for APTC, yes, there are significant increases for 2022, but we also want people to avoid owing back some or all of their credit on their tax return. And for cost sharing reductions, obviously, we want people to get their highest upfront financial assistance. As far as what to update, obviously, we want people to update income, because their 2022 income projections might be significantly different than their 2020 tax return data that's in the data hub, or the 2021 income projection. And we're going to talk about how those two things factor into the redeterminations. And people who had unemployment, as I mentioned before, they are currently have access to a $0 benchmark plan, but they'll and that will end, because that was a one-year deal. And so in 2022, they'll no longer have their income calculated as being at 133% of FPL. And also, we want people to update their household size. Maybe they've added a household member, or maybe a household member has left the coverage group, or rather has left the household. And we want them to update other offers of employer-sponsored coverage. And this is particularly important because people are obligated to do this. So they're actually not supposed to be re-enrolling if they have a change in employer-sponsored coverage. But many people don't know that. And we also want them to explore new health plan options. So many rating areas will have new insurers in the marketplace. There may be changes to premiums. We've definitely heard about some insurers dropping premiums. There may be changes to the kinds of plans that they're offering. Certainly, provider network changes happen all the time. And we want them to do this because, now is the time to make a choice, and switching plans outside of open enrollment is hard. It's also important, and again, we're going to talk about this a lot, to cancel an unwanted plan. So it's really important that if people decide that they don't want to re-enroll in the marketplace, or if they're enrolling in Medicaid or CHIP, they need to cancel their old plan. Otherwise, they will be re-enrolled. Next slide. So I've been using these terms, and I just want to be clear about what we're talking about when we use these terms. It's a two-step process when no action is taken. There's a redetermination and there's re-enrollment. Redetermination is about the money. It's the process HealthCare.gov uses to assess continued eligibility and the amount of financial help. And re-enrollment is about the plan. And this is how HealthCare.gov assigns a 2022 plan. Next slide. So here's a little schematic of what this process looks like, and we're going to dig into each element of it. So the marketplace first starts by talking to the IRS and getting information on the most recent tax returns filed. And so that is information from the 2020 taxes. And then people are sort of divided up into two groups. There are folks who are eligible to re-enroll with APTC CSRs and those that aren't. We'll talk about why they aren't. People who are eligible could do nothing. Eligible for APTC could do nothing, and they would have their coverage continue. Or they could provide updated information to the marketplace, which is always the best policy. to make sure that that they knew that the income information is most accurate. Then there are people who are eligible to re-enroll, but they don't get APTC. So those folks obviously should come back to the marketplace, but it's important to note that even if their APTC is canceled because of certain reasons, they could still be auto-enrolled, which means they could be on the hook for premium costs when they thought their plan had ended. So we're going to start breaking down some of these notices with the one that folks are already getting. These were sent out, I think, last week. The Marketplace Open Enrollment Notice, or MOEN. It's a description of redetermination and the re-enrollment process that's based on the enrollee situation. So there are, I think, 5 different versions of the MOEN, and they all emphasize the importance of updating the application. But there are several different groups they break out notices for. It'll explain how the APTC and CSRs are determined for 2022 if the enrollee doesn't contact HealthCare.gov. And for certain people, it will warn that if no action is taken, they'll be re-enrolled without APTC. So we're going to talk now about some of these groups that are eligible for redetermination of APTC. So I said that there were 4 or 5 versions of the MOEN. So who's getting which version? So we have, our ho-hum standard group. This is going to be where most people fall. These are folks who authorized HealthCare.gov to pull tax data related to their income and household size. So they check that box. They updated their application in the last couple of years. So they've come back to the marketplace at some point in 2020 or 2021. They enrolled in 2021 coverage with APTC and or CSRs. And they don't fall into one of the groups that we're going to talk about on the next few slides. There's also a group that is called the income-based outreach group. And that for that group, it's actually, they're not getting separate notices this year, which is why we have the X through there. They used to get special notices, but most of them were based on, so like the name implies, they're based on income. And because the marketplace now has subsidies available past 400% of the poverty line, some of these things just don't apply. So they're not getting special outreach. They're just being told, come back to the marketplace. So more people are getting that straightforward message. And then there's a group that has unemployment compensation. And this is the group of 200,000 plus people that we talked about earlier. They received or were approved to receive UC in 2021. Therefore, they were eligible for APTC and CSRs as if their income was 138% of FPL. And they're likely to experience a reduction in or loss of financial assistance in 2022. And so they definitely need to come back to HealthCare.gov. The problem is that someone was eligible for this, even if they had income that far surpassed 138% of FPL. So if they don't come back, they're going to get a cruel surprise when their premiums are much higher. And so if no action is taken, they're going to be auto-renewed with redetermined APTC or CSR, which could result in much lower or even no financial help. Just a quick note that this doesn't apply to the immigrant enrollees who are eligible with income below 100% of FPL. They'll continue to be eligible under the special rules for immigrants who are not eligible for Medicaid coverage. And go back, please. And it's important to note that if someone has income below 100% of the poverty line, these folks will still be auto-renewed. They were swept into this unemployment compensation provision. So even if someone was otherwise not eligible for marketplace coverage because they had income below the poverty line threshold, they were still, by the way the law was written, eligible for subsidies through this unemployment compensation provision. But if these folks don't come back, they will be swept into auto-enrollment. And their policy will be renewed, but they won't be eligible for APTC and CSRs. So we could have a lot of folks who are responsible for a January premium if they don't terminate their plan. There are some other groups at play here. These are folks who are not eligible for a redetermination of APTC. We've got what we call the opt-out group. So those are folks who didn't authorize HealthCare.gov to pull tax data related to income and household size. And since HealthCare.gov can't look up their income information, it can't redetermine eligibility. So those folks all need to come back. Then we've got the repeat passive group. These are folks who auto-renewed for the past 2 years. So they haven't been back to the marketplace for a while. And the IRS doesn't know what they're doing either. And so they've really got no income information that can be used. Then we have the people who are not currently receiving APTC or CSR. They're enrolled at healthcare.gov, but they haven't been receiving financial assistance. And it's important to get these people back, especially this year, because they might be eligible for financial assistance, like people who had income over 400% of the poverty line and weren't eligible before might now find themselves eligible for help, and even significant help in some cases. What we are not looking for this year, this is a big change that's important to note, is we used to have this failure to reconcile group. These were folks who on their 2020 tax return did not do reconciliation. So those folks are actually going to get some relief this year. And this group is not going to be looked at in 2021 or 2022. And part of that, a big reason for that is that for 2020, people who owed money back through reconciliation were given special forgiveness on that, and they didn't even need to file an 8962, the tax form that's used to reconcile. And so the IRS doesn't really have good information on them, and so they can't give good information to the marketplace. So those folks are getting a break. But I will note that it's still important for people to file. There's no, blanket forgiveness. If you owe money back, you still are going to owe money back. This was a one-time deal for 2020 only, and it's important to file for 2021 and 2022, even if there is this forgiveness given. And again, for all of these groups, if no action is taken by the consumer, they're going to be automatically re-enrolled, but without APTC and CSRs. And for some people, that could be a real hardship. So what happens if someone is renewed without APTC? Well, it's very possible that they can't afford the premium. And they have to terminate their plan to avoid auto-renewal and being billed in January. And I know that many people you see are sort of on the cusp between Medicaid and marketplace eligibility. And so the cost of a full premium might really be prohibitive. And the marketplace gives you a number of ways that you can cancel your plan. They have it in a couple of different spots. Here's what one of them looks like, where you have a very clear button there that says stop coverage. And so this means that people won't be auto-renewed. If they do get auto-renewed and don't pay their premium, then they'll go into a grace period. The enrollee has to catch up on all premiums by the end of the 3rd month of the grace period. And if all premiums aren't paid, coverage is terminated back to the last day of the 1st month. So you go through 3 months of not paying, it's going to be as if you're still going to be on the hook for the 1st month. If you use services in the 2nd and 3rd months, the insurer is not going to pay the claims. So again, you're going to be on the hook for the cost of services and at the provider's full charges, not the insurer's discount charges. So even if at the end of that grace period, the coverage is terminated by the insurer, then the enrollee is still liable for the January premium. So it's not something that you can just sort of let lie. And this is an important concept for people to understand because it's not really intuitive. The intuitive thing is that I've enrolled in a year of coverage, and that year ends December 31st. And so why do I have to do anything? And that's because the policy of the marketplace is to keep people in the marketplace unless you tell them otherwise. So it's so it's an important concept for people to grasp. And it's also important to note that non-payment could mean that the insurer denies future enrollment in a plan. And so someone might have to go to a different issuer if they can't afford that January premium, and even through the year can't get caught up. And of course they can go to collections, all of these things that happen when you owe money. Next slide. And then there are folks who are not even eligible for auto renewal. So not only do they not get APTC, but they also don't get their plan renewed. And this is generally people who are in a group that have Medicare coverage. So, and this is because of another federal law, not the ACA, but if an insurer learns that someone is entitled to Medicare Part A or is enrolled in Medicare Part B, insurers will terminate the marketplace coverage for all enrollees. And that's because of this. There's a non-duplication provision that basically says insurers can't sell a policy to people who are enrolled in or eligible for Medicare, and individuals who are not in Medicare but are in this group. So the other family members need to return to the marketplace and re-enroll in coverage. They're going to be kicked out. And so they need to come back and re-enroll. And if open enrollment has ended, a special enrollment period is available for those eligible individuals. So, and they'll also get several notices that say, to the family members who are still eligible for marketplace coverage, please come back. They'll get notices from the insurer about the termination of coverage, and they'll get notices from the marketplace that say, call the call center, we want you to come back. Next slide. So let's get into the numbers game on how APTC and CSRs are determined. There's a hierarchy here. And the first thing that we're going to use is 2021 projected income. If that isn't available, they'll use 2021 projected income. Or if no projected income for 2021 is available, they'll use 2020 tax data. And if neither of those are used, they'll use 2020 income. And to do this, they're going to take into consideration the updated federal poverty guidelines and the new benchmark plans. And so we're going to break that down into several examples. And these are all folks who are being redetermined, or who are being automatically redetermined. So first we've got Katie, and she updated her income information at open enrollment or sometime during the year, and she re-enrolled in 2021 coverage. So if Katie kind of lets it ride, so she doesn't update her income for 2022, she's relying on the auto re-enrollment, HealthCare.gov is going to adjust her most recent 2021 projected income so that her 2022 FPL matches her 2021 FPL. And so you can see for Katie, she had a 2021 income projection at 150% of the poverty line. It was just over $19,000. And so HealthCare.gov is going to say, okay, your $19,000 equaled 150% of the poverty line. So we're going to say in 2022, because the poverty line changed, that we're going to keep you at 150% of FPL. Otherwise, Katie would, drop down to 148% or 147%. But they say, no, we're going to keep you at 150%. And so, of course, they do that by adjusting her income. And then we've got Sasha. She enrolled in 2020, but then auto-renewed for 2021. And she didn't come back to the marketplace. She didn't update her income at any point in 2021. So the marketplace doesn't feel like they have the best projection for the best projection based on 2021 income because she didn't come back in 2021. So the most recent thing they have is the 2020 tax data. And so that's what they adjust. If according to the tax data, she had income of 265% of the poverty line, again, they're going to pull that forward and say that for 2022, she still has income at 265% of the poverty line. And then they'll adjust her income accordingly. Next slide. So again, more examples, just to be clear about what's happening here. So let's return to Katie. and look at Katie in a number of different scenarios. This is Katie without an income update. Again, her projected household income was at 150% of the poverty line. So you can see that her pre-ARP 2021 APTC, she was paying 4.14% of income, and her benchmark plan was $4,000. And so that means her premium tax credit was just over $3,200. And all of this should be familiar to you if you've done this before, if you joined us for our premium tax credit webinar. So I won't go over the math on that. Now, during 2021, she was redetermined. Now, that could have happened in two ways. She could have either come into the marketplace and do all the clicks that they told you to do to come in and get your additional APTC, but she didn't update her income. You know, she just kind of clicked through those boxes to get her updated APTC. Or it could have happened when she was, if she was in the batch redetermination. So the redetermination that happened when HealthCare.gov just flipped the switch and said, okay, if you meet certain conditions, you're going to be redetermined automatically. And so that was the update to Katie's APTC. All of a sudden, because she's at 150% of the poverty line, she got APTC equal to the cost of her benchmark plan. And so that means, what does that mean for 2022? Her redetermined income is going to be consistent at 150% of the poverty line. And it's going to take into account her new benchmark plan. The cost of her benchmark plan went up this year. And it's going to keep her at 0% of income, which is the ARP adjustment. And so her premium tax credit is going to go up to $4,200. Next slide. And then, so let's look at Katie again, but what if she updates her income? So this time she updated her income when she came back in to get her ARP savings. She realized that, okay, my income is increased. I should, make sure I'm getting the right level of savings so I don't owe money back at the end of the year. And so she updated her income to $25,000. So you can see now she's paying 1.84% of income, and she's getting a credit of about $3,500. So what does that mean for redetermination? Her 2022 redetermined income is going to be $25,245. And why is that? It's because they're going to hold steady her 196% FPL. So you can see that even though she has more income, her APTC has actually gone up because of the ARP changes. Next slide. So one more scenario with Katie. And this is a little more complicated. In 2020, she enrolled with a projected income at 150% of FPL for the plan year. Then in 2021, she didn't take any action, so she was passively re-enrolled. And her income was adjusted the way that we talked about. So it was adjusted by keeping the 150% constant. But then also in 2021, she filed her 2020 taxes to reconcile the credit that she got in 2020. And when she filed her taxes, her household income was actually higher than she had told the marketplace at $22,000. So the question for us is, what is her redetermined income for 2022? The 2021 income projection was just a redetermination by the marketplace. They didn't really have good information about 2021, so they just made that adjustment. And so for 2022, they're not going to take that again. They're not going to make a second adjustment. Instead, they're going to use her tax return data, but they're still going to follow the same pattern of holding the FPL percentage constant. And so you can see that they've upped her income, and because of the ARP, again, she's getting a higher premium tax credit than she did before. Next slide. And thank you. So now, so all of that was talking about the money, how the APTC works out. Now we're going to talk about the plans. So this is a little overview of our auto enrollment process. If no action is taken by December 15th, a person will be auto-enrolled in a plan starting January 1st. So the goal of auto-enrollment is to get people in coverage starting January 1st. We want coverage that is continuous across years. And those subsidies are adjusted in the ways that we just talked about. There's a hierarchy to determine plan auto-enrollment. So the first option, and the option that I think most people end up with, is to re-enroll in the same plan as in the previous year. But if that plan's not available, the marketplace is going to enroll you in a plan with the same issuer that's as similar as possible to the current plan. And if that's not available, they can pair you with a new plan from a different issuer that is as similar as possible to the current plan. So you get further away from what the initial choice had been of the enrollee, which really is another reason for people to come back into the marketplace. And the timing of this is such that now they have time. And so even if someone doesn't take action, kind of ignores the notices, then all of a sudden they get a notice in mid to late December that they've been enrolled in this plan, and they have no idea what it was. This wasn't what I signed up for, last year. They still have the chance to cancel it as long as they do it by December 31st. And they have a chance to come back in and get a different plan as long as they do that by January 15th. Next slide. So breaking down what it means to be auto-enrolled into the same plan as the previous year, they're going to get a notice, several notices actually, that's going to talk about premiums, benefits, and cost sharing changes. And one important note, and this will be especially important this year because of the ARP changes to APTC, is that the premium that is on the notice that they get from insurers, it could either have the current monthly APTC or a redetermined APTC, depending on the timing of the insurer's notice and that communication between HealthCare.gov and the insurer. So this could be really consequential this year because some people who didn't claim their ARP discounts will potentially see their APTC as it was pre-ARP. I apologize for all the acronyms, but you know how it goes. And so they might have much less APTC than they are actually eligible for on this notice. Other people will have the redetermined APTC, and then that will be much more accurate. The notice will also contain changes to the plan. And as you heard from Ina and Ariana, remember that changes to the plan can also include changes to the provider network, which is really important for some people. And that kind of specificity is not in these notices, but is always something that people should pay attention to. As I said, people can return to healthcare.gov until January 15th. And again, these dates are confusing, and that's why we keep mentioning them, is that auto enrollment happens early, but you still have a chance to change your mind. Now, if you do change your mind, note that you as of December 15th or December 16th, you will have been enrolled. And so you will have January coverage. Yay, you have coverage, but that means, boo, that you're going to owe the January premium, even if you say, this is not the plan that I want. And so basically you would owe January's premium. And then as long as you sign up by January 15th, the end of open enrollment, you would be able to enroll in a new plan, but that would start February 1st. Next slide. Enrollment into a new plan, if your current plan is not available, the notice is going to have everything that we talked about on the last slide, plus it's going to let you know that you're eligible for a special enrollment period due to discontinuation of the previous year's plan. So that will give you additional time beyond the open enrollment period to choose a new plan if that's what you want to do. Next slide. Finally, and I don't know how often this actually happens, but the third tier of possible changes is people being auto-enrolled into a new plan with a new issuer. Because we've got more issuers coming in and fewer leaving, I think that this is going to be less of an issue than maybe it was a few years ago. But the marketplace can do this. They can match you with a different issuer. The notices, there's a lot of notices when this happens. You get a discontinuation notice from the current insurer to say, hey, we're not offering your plan anymore. And in fact, we're not offering any plans. And in that case, you're eligible for a special enrollment period. And then there is a notice from HealthCare.gov saying that, hey, we matched you with a different plan with a different insurer. And then you also get a notice from the insurer. And this is called a cross-issuer notice. And it tells you the details of your new plan and of how to pay the first month's premium. So you have to pay the first month's premium to effectuate coverage. And if there's no January premium payment, enrollment is not going into effect. So, you know, if you were enrolling in the same plan, if you were keeping your plan across years, you wouldn't owe what is called a binder payment. You would just pay your normal January premium. But in this case, because you're with a new carrier, you have this binder payment, and you need to make it by usually by January 1st. An insurer might have something different, but you generally have to make it by January 1st in order to really enroll in your coverage at all. Next slide. So a little bit more about this SEP. If an enrollee's 2021 plan is discontinued, even if there's an offer of a plan from the same insurer, if your particular plan was discontinued, then you're eligible for an SEP based on loss of qualifying coverage. And so the SEP is 60 days before or after discontinuation, the discontinuation date, which will be December 31st. If you enroll before, the effective date is going to be the first date after loss of coverage. And so if you get in there by December 31st, then your coverage will start January 1st. So that is the key difference between the SEP and the continued open enrollment period. So if you were taking advantage of the regular open enrollment period, if you enroll on December 16th, you don't get coverage until February 1st. But if you're in this group that takes advantage or that has an offer of a special enrollment period, then your effective date is actually the first date after loss of coverage. So you get coverage sooner. Or you can enroll after 60 days after the discontinuation, and then you follow normal effective dates. Oh, no, I'm sorry, you don't follow normal effective dates. Your effective date is going to be the first day of the month following plan selection. So you're not using that 15th day of the month rule. That means that people who enroll after the 15th have to wait until the first day of the second month. Instead, you get an accelerated effective date. Next slide. All right, let's go back to our friend Katie. Katie's plan is no longer available at HealthCare.gov. So she receives lots of notices to tell her this. She gets one from the issuer, her old issuer. She gets one from HealthCare.gov, and she gets a notice from the new issuer about the plan she's been matched to. So with all this paper, she checks her HealthCare.gov account on December 20th and sees two things that she needs to work on. So first, she's auto-redetermined for APTC of $300 a month, but she realizes that the income that the marketplace has for her is not right. And so she changes her income to reflect what she thinks she's going to make in 2022, and her APTC eligibility. Her APTC amount is now lower. She also sees that she's been matched with a new plan with a new issuer. And so when she updates her application, it's clear that she has a new plan with a new issuer, but she likes the plan. It's good enough. She wants to enroll in it. So she has to pay that first month's premium. Otherwise, it's going to be as if she wasn't matched at all. She won't have coverage in January or going forward if she doesn't pay her premium January 1st. Next slide. But what if she wants to change her plan? She saw she was matched with a different insurer, and she doesn't like that. When she updates her application, she notes that she's losing coverage on December 31st. So that's how she gets in the door for her SEP. Because her plan was discontinued, she's eligible for that SEP. Then it's a little tricky. If she changes plans after January 1st, so she takes advantage of the 60 days after part of the SEP, if she auto-enrolled in the plan she was initially matched with, then she has 60 days to enroll to use the SEP, and the coverage will be effective the first day of the month following plan selection. So she has that accelerated effectuation. But if she never effectuated the renewal plan, so with this second insurer, she just never paid that January premium. She's not going to be auto-enrolled in any plan, but she can still use her SEP to enroll in coverage after January 1st. But she might have a gap in coverage. She will definitely have a gap in coverage because she's not going to be able to get enrolled until the first day of the following month. Next slide. So more notices, so many notices. People can get really overwhelmed and confused. First, we have an eligibility determination notice. This is also called an EDN. Everyone is going to get an EDN. It tells you about your eligibility determination for the upcoming plan year, and it confirms the plan name, plan ID, and financial assistance. If you didn't get an EDN, you're not enrolled. There are multiple versions of the EDN, just like there are multiple versions of the MOEN. It tells you if you're eligible for a QHP or a qualified health plan and APTC. It tells you if you're just eligible for a QHP. It tells you if people in your household might be eligible for Medicaid. And it assesses eligibility for Medicaid for all or some of the people in the plan. It also tells you what your next steps are. So you can see in this sample EDN, the next step is to choose a plan and pay your premium. And there's some advice. You can choose a silver plan to get cost sharing reductions. So the EDN does try to spell out sort of what has happened and what you need to do next. You also get an enrollment confirmation message. So this is sent if you've done everything automatically, you haven't gone back into the marketplace. This is your notice that, hey, we re-enrolled you. It confirms the information from the plan. It also will give you the information that we've just been talking about. So whether this was standard, meaning you're going into the same plan, whether you were moved around, whether you lost your financial assistance, or whether you were enrolled but need to submit documents. Next slide. Terminating coverage, and we've talked about this several times, and we just like to bring it home because we hear all the time about people who thought their coverage automatically ended December 31st, and so they didn't do anything. And then they're so surprised when they get this January premium that doesn't have any financial assistance. And this is especially painful when you have someone who enrolled in Medicaid because they were newly eligible for Medicaid, and they failed to stop their marketplace premium. People, rightly so, think that it's all connected, and that if you enroll in Medicaid, that the marketplace will know that you are enrolled in Medicaid, and that's just not the case. So you actually have to go into the marketplace application and terminate your 2022 coverage. And you can see here, we showed you another screenshot if you take a different route to get to the termination page. But here, big red button that you got to push to end your coverage, and it will end as of the end of the year. And again, if the coverage isn't stopped, the enrollee might be responsible for January's premium, which, as we've said several times, can be pretty painful. Next slide. So we've got some quick tips for assisters. Emphasize the importance of updating information for all the reasons that we've talked about, and shopping for plans. One thing that we haven't really talked about, but you've heard in other webinars, is that because because the APTC is more generous. Some people who bought bronze before because that was the premium they could afford might now find silver affordable and might, qualify for cost sharing reductions that they didn't even know about. Some people who were in silver, maybe those who didn't qualify for cost sharing reductions, could find gold affordable. So I think that there will be more, even more benefit this year to shopping and shopping for plans. You also obviously want people to project their 2022 income, especially in these days, because if we're relying on a 2021 projection that was made last November, or relying on 2020 taxes, incomes have fluctuated so much for many of the low-income clients that you see, and it's important to capture that. Also, remind people that auto enrollment happens after December 15th for January 1st coverage, even though open enrollment extends to January 15th. Look out for people who are eligible for CSRs, but who are in non-silver plans. Maybe that was by their choice, or maybe they just didn't know about the cost sharing reductions. And for the final time, remind people to cancel their plan if they don't want to re-enroll. And I think, that we're ready for questions.
Great. Thank you so much, Tara. So we have a few questions that came in. The first question is, if the consumer doesn't get APTC, do they still get a grace period for payments?
No, and that's an excellent point. So the grace period is, well, I should qualify the no, but the grace period that I spelled out, that is 3 months, is only for people who are getting APTC. If people are enrolled in marketplace coverage and they don't get, well, if they're enrolled in individual market coverage, so bigger than the marketplace, and they're not getting APTC, then state rules are going to apply. And state rules sometimes have a grace period. I think a lot of them are like 20 days or something like that, but it's not 3 months for sure. So then you would follow your state rules if people aren't getting APTC.
Another question about renewals. If a consumer doesn't pay the premium for a month or 3 months and then pays the full balance before the 90-day grace period ends, does that negatively impact them in any way? Is there a risk that the insurer may not re-enroll them?
No, the insurer would have to re-enroll them. So if you fully pay off that your premium payments during the grace period, so they haven't canceled your coverage yet, and you catch up, then you are good. You're fine. Your claims will be paid in every month, and the insurer can't negatively impact you because of all of the coverage rules that insurers have. It's really an unfortunate exception that they are able to not re-enroll you if you owe premiums. That's an unfortunate exception to the coverage requirements for insurers.
And if a person is auto-enrolled, then decides to change plans after December 15th, will they have the auto-assigned plan for 1 month and then the new selected plan starting February 1st?
Yes, that's exactly how it works. So you're still going, if you come in after the 15th, December 15th, then you're going to have that plan that you've been assigned in January. And unless you cancel by December 31st, but even if you cancel, let's say you cancel December 31st, you don't get that January plan, but then you have a gap in coverage. So it doesn't make your new plan start any faster. So the case that I think most people would see is that they are auto-enrolled and then February 1st, their new plan picks up. And Ina, actually, can you go to the next slide, please? The resources slide. Yeah, I just want to, for all of you policy nerds, I just wanted to point out these resources this time because they're particularly useful. There is new guidance on the failure to reconcile provision that we talked about. And there's also all of this guidance, and it looks outdated, but if you follow it back, the guidance for coverage year 2016 really lays out some of these categories we were talking about on redetermination. And then that was basically carried forward with some tweaks. And now it's the 2019 guidance that is kind of the operative thing, except for the changes that they've made that are due to ARP and the failure to reconcile provision. And then you can see we have links to where the notices live if you want to do a preview of the kinds of notices people will get, just so you can familiarize yourself with what your clients are seeing. Sorry, Ina, go ahead. We can take more questions.
Great, thanks. So if a consumer is auto-enrolled and wants to change their plan after December 15th, but they do this before December 31st, will their new plan start January 1st or February 1st?
February 1st. So the December, it's confusing because the termination and the start date can be different. So if you enroll December 16th, no matter what, unless we have a discontinuation, but in most cases, you are going to get a plan started February 1st. The exception there is if your plan was discontinued and you get your SEP. If that's the case, if you're enrolling via an SEP instead of via open enrollment, you can get an earlier effective date. And you can cancel your plan by December 31st. So you could choose to have a bare month in January. But if you just are auto re-enrolled on December 16th, you don't cancel by December 31st to stop that auto re-enrollment. Then you would have January coverage under Plan A and Plan B coverage in February.
And if a person is auto-enrolled in a plan with a new carrier, if they go back in by January 15th to change plans, can they also change carriers?
Yes.
Great. And then one last question: how can you help people who lost their APTC CSR and were auto-renewed and are now stuck with the full premium for January?
Oh, that's a great question. So it's going to depend on why they lost APTC. So some people lose it, but they really shouldn't have. So maybe they lost it because they didn't give the marketplace authorization to look at their tax data. If that's the case, they can give the marketplace authorization of their tax data. They can go in to their HealthCare.gov application and give that authorization and be redetermined for APTC. So remember that you need an SEP to get into a plan, but you don't need an SEP to have your APTC redetermined. And so you can still have that adjusted, including adjusted from zero. So I think that is probably for a lot of your clients the first thing that I would do is to see, okay, if someone is auto-enrolled without APTC, are they eligible for APTC? What can we do to get that right now? If you've got a client, for instance, one who was eligible because they had the unemployment compensation provision, but they have income under 100% of the poverty line, and then they're auto re-enrolled, there is not a ton you can do. You can cancel the plan, which I would recommend. If it's after December 31st, you can't terminate it for January, but you can terminate it for February. So I would do that. Some people are going to end up in the coverage gap, and there's not going to be a lot that you can do for that. Then you're really trying to figure out how they pay the January premium. And I wish I had a better answer for that, but I really don't. We've got some upcoming webinars. As if this wasn't hard enough, we're going to put together a webinar next Tuesday that goes over many of these issues that we've talked about over the last several weeks. And then we've got a webinar after that next Thursday on best practices for assisting people with disabilities, including things like etiquette and accessibility.
Great. Thank you so much, Tara. And as a reminder, we'll be distributing the materials from today's session via email, and we'll post everything to our website. You can register for upcoming webinars on our website under upcoming webinars. You can also find additional resources on the website, including reference charts, guides, and frequently asked questions. And if you have questions or need assistance, please email us at beyondthebasics@cbpp.org. With that, we'll bring today's webinar to a close. Thank you everyone for joining us today.